I'm Dr. DiBernardo, and I'm going to tell you more about Cellulaze. And it's been very exciting for us because, as they said, over the years, there have been treatments, there have been creams, there have been ointments, there have been machines that sucked, rolled, and we had a little promise because some of those devices looked like it was getting a little better, but what we found out in the end is they were just creating some swelling, and when the little dimples swelled, they looked better, but after a few months that went away. And those devices had to use 5, 10, 15 treatments to get that non-lasting result. So we, for a long time, thought cellulite was impossible to treat. We didn't have anything to work for it. And over the last 3 years, we have been working on this project, and I'm going to tell you a little bit about that and how we got to cellulite treatment. So first of all, let's define what it is. Cellulite is a topographic change that's claimed to occur in most postpubertal females. It's a modification of the skin surface, and you can see dimpling or nodularity or orange skin appearance, and it can be in the pelvic region, the legs, the thighs, the abdomen are the most common areas. It was just FDA cleared 2 weeks ago, so it's fairly new to the public, although we've been working on it for a long time. But this is a time where in the next few weeks and few months, you're going to start to see it in all the major publications and TV and newspapers. We actually wrote the first paper in the medical journals from our initial work that was published in March of 2011 in the Aesthetic Surgery Journal. And that was the first introduction of what Cellulaze could do. But as you know, it's this orange skin appearance that is what really creates a difficulty for many women, especially in the summertime when those areas are exposed. Cellulite is typically this look. It's an unevenness to the skin. That's a milder form of cellulite, but we could have more severe, which we call grade 3, which adds more hills and valleys to the surface. And as you can see, they're grades of cellulite, and it can get worse in some people. Obviously, most want it to look like this, nice and smooth and tight, and that's what looks good in shorts or a bathing suit. Why don't men get it? Men and women have a different skin, a different architecture to the skin. And men's skin, because of the triangularity of the surface under the skin, it just doesn't create cellulite. Women, on the other hand, have a situation under the skin that could create cellulite. And this is what took a long time to understand, because until we talked to experts in this around the world to ask, what do you think is the cause of the cellulite? We didn't really understand it. And by putting that all together, we came up with 3 things happening under the skin that create the cellulite. And there are documented studies in the medical literature which were the basis of what we were going to recommend. This one shows the fat herniating under the skin. The vertical septi can get very thick, and I'll show you diagrams of this, which is easy to see. But basically, the final resolution of this was 3 things that were causing the cellulite. There was fat at the base, right under the skin, called the subdermal fat. And that fat was creating bulges that caused the hills that we see. Then these vertical bands, which are normal in most people, skin would kind of slough off. But these vertical bands called septi become scarred or fibrotic, and when they get that way, they start getting tighter and pull down on certain area of the skin. And that is the basis of the dimples that we see in cellulite. And finally, the top end of the skin, called the dermis, gets thinner. And as it becomes thinner, that allows the fat to herniate into the skin, causing the bumps that you see in the orange skin. And the study we set up was to look at all these different causes and how we would go about studying them, proving them, and treating them. And what was come up with this clinical knowledge and then the work of the engineers was a laser going through a little fiber about 1 millimeter under the skin, and this would fire to the side, not straight ahead as our lasers had in the past. By firing to the side, it allowed us to do several things. First, if we aimed down, we would smoothen out those bubbles of fat and create an evenness to the bumps or lumps. By turning the side firing fiber to the side, it allowed us to use it like a saw to cut these bands, and when we divide them, the skin would then pop back up. And this would help the dimples that we're looking at. And finally, aiming upward. Aiming up would do two things. The laser, which has a very great affinity for fat, would melt the fat herniating up into the skin. But the heat and going to a certain temperature, which we proved in previous studies, creates a thickening to the skin. And because the thin skin is one of the causes of this, thickening it helps. But it's all three together. And the previous treatments, which might have been non-invasive, not only did not address the three causes, they probably didn't address one of those very well. So that's why it had been a problem historically. In our studies, we showed high-resolution ultrasounds, and this is the dermis of the skin. The fat is black, and these black areas are the fat poking into the surface of the skin. Afterwards, at 6 months, not only did we melt those herniated areas of fat, but we also thickened the skin so it wouldn't come back. When we mark the patients before actually doing the procedure, we mark the raised areas in green, the depressed or the dimples in red, and this is our roadmap for treating the patient in the Cellulaze treatment. When we did the study, we had improvement of the cellulite, improvement of skin texture, and the patients did their own ratings, and they had a 93% satisfaction of what was done in the study. Skin thickness increased by 25%, and this is out to 1 year. And also skin laxity decreased, or the skin became tighter. And this, again, was after 1 year. And that's more of the ultrasounds. So looking at results, we could take different abnormalities, different types of cellulite, even these deep dimples. And you'll notice in the study we treated a certain area. But you can see that after 3 months, 6 months, 1 year, those areas were still maintaining. We even did 3D imaging to also assess these dimples, where you could see the red showing the depressed area, and after 1 year, how it's more flattened. So here are several before and after pictures of different patients, and if you notice, every patient has a different look. Some have divots, some have streakiness, some look like mattress pattern. All are different. That's why it has to be individualized and mapped out. This is on the lateral thigh, and you can see how that's smoother after 6 months. This is in the back of the thigh, where you get a more horizontal streaking appearance to the cellulite, and that's after 6 months. Here's another mattress pattern, which are not the hills and valleys, but just the slight bumpiness in the area. Depressions. and just other forms of irregularities that occur on the side of the leg, the back of the leg. More of the hills and valleys. And then getting up into the buttocks, it's not only on the thigh, but you can get that dimpling on the buttocks area as well. And this works in all areas where you have cellulite. And finally, this is a patient we just saw recently who had very bad cellulite on the thigh, but not only the lateral thigh, anterior. She had it around the whole thigh, all areas, in back and front, sides, and in the middle. And this is the photo at 2 months after the Cellulaze treatment. So the special thing about this treatment, which we waited years and years for, is that now you can attack the cellulite with a single treatment. There's long-lasting results. Our first patients now are 3 years out. There's a high satisfaction rate by the patients, and it can be done in the office with local anesthesia. And at New Jersey Plastic Surgery, which is our practice, we have done a lot with this technology. We were instrumental in the development of Cellulaze. We were the lead clinical research center for the Cellulaze research. We're the lead training center for doctors now getting the devices and learning how to do it. We were the first published paper in the medical journals. And I've presented this at most national meetings on the initial studies. We have performed more Cellulaze cases and treatments than anybody else in the world. And we have the longest experience than anyone else in the world. So that really is what Cellulaze is all about, what the machine can do, and why this is something new and exciting that we really never had before. So if anyone has any questions, I'll be happy to answer. Very good question. A few years ago, one of the dermatologists did a study called subcision, where they took a little sharp instrument and went under the skin and kind of divided it. It looked like a little sharp pickle fork. And by cutting those fibers, initially it did look smoother, but the body has an innate ability to reform itself. So when you do a sharp excision of it, the fibers eventually come back together. We see a similar thing. Many will ask, in the muscles over here, rather than using Botox, why not just divide them? And people have divided them doing brow lifts. And those muscles heal back together also. So the difference is we have a new term. We call it thermal subcision. When we use laser and heat energy to divide it, it kind of shrivels the bands up and down, and they are shriveled up and they don't have the ability to form again. So thermal subcision rather than sharp subcision. It depends on the number of sectors. We measure sectors that are 5 by 5 centimeters. So each one takes about 2 to 3 minutes, depending on the kind. But when we look at legs like that, someone might have 20 sectors, 40, 60. So it's about, depending on a small, medium, or large case, it could be 30, 60, 90 minutes. You may, if it's a big case like that, you may be in the OR for maybe 2 hours for going around the whole thigh on both sides. But again, it depends on how much area you have. Typically, it's around an hour. And again, it's local anesthesia. One thing we didn't go over is what to expect afterwards. I don't want to give the impression that this is a non-invasive procedure where you do it and then you put your shorts on the next day and go to the beach. It is a minimally invasive procedure, so like liposuction, maybe not to that degree, you would have some swelling, you might have some bruising, you do wear a compression garment on there, but you can go back, wearing that compression garment, you can go back to your daily activities in the next day or two. So it is something, it's a procedure, but it's not something that's going to keep you out of work for weeks. And because of the stimulation of the skin, it will continue to get better. With the studies, we probably saw the best looking results at 6 months. So it keeps getting better and better as time goes on. Thank you for attending, and good luck.